Hello everyone, and welcome back to the channel. Today, we're diving into a topic that affects more people than you might think, yet often goes undiagnosed for years: Hypermobile Ehlers-Danlos Syndrome, or hEDs for short. Maybe you've heard the term, or maybe this is your first time. Either way, my goal today is to demystify what hEDs is, what it feels like to live with it, and how it's diagnosed and managed. So, grab a comfy seat, and let's get started. So, what exactly is Ehlers-Danlos Syndrome? It's a group of inherited disorders that affect your connective tissues, primarily your skin, joints, and blood vessel walls. Think of connective tissue as the glue that holds your body together. It provides strength and elasticity. When this glue is faulty, things can get complicated. There are 13 different types of EDs, but the most common one by far is the hypermobile type, hEDs. The hallmark of hEDs, as the name suggests, is joint hypermobility. This means the joints have a wider range of motion than is typical. People with hEDs are often described as being double-jointed or unusually flexible. They might have been the kid in gym class who could bend their thumbs back to their wrist or do the splits without even trying. While this might sound like a cool party trick, it comes at a cost. When your joints are too loose, they become unstable. This can lead to frequent joint dislocations or subluxations, which is a partial dislocation. Imagine your shoulder just popping out of place while you're reaching for something on a high shelf, or your kneecap shifting while you walk up the stairs. This isn't just painful in the moment. It causes wear and tear over time, leading to chronic pain and early-onset osteoarthritis. The pain can be widespread and persistent, affecting muscles and nerves, not just the joints themselves. But hEDs is so much more than just bendy joints and pain. It's a multi-systemic disorder, meaning it can affect many different parts of the body. Let's talk about the skin. People with hEDs often have soft, velvety, and sometimes stretchy skin. It might bruise very easily. You might wake up with bruises and have no idea how you got them. Wound healing can also be slow, and the scars that form might be thin and papery, known as atrophic scars. Then there's chronic fatigue. This isn't just feeling a bit tired after a long day. It's a profound, bone-deep exhaustion that isn't relieved by sleep. It can be incredibly debilitating, making even simple daily tasks feel like climbing a mountain. This fatigue is often a combination of the body constantly working overtime to stabilize loose joints, chronic pain disrupting sleep, and other co-occurring conditions. One of the most common co-occurring conditions is postural orthostatic tachycardia syndrome, or POTS. This is a form of dysautonomia, meaning the autonomic nervous system, which controls all the automatic functions like heart rate, blood pressure, and digestion, doesn't work quite right. With POTS, when you stand up, your heart rate can skyrocket, leading to dizziness, lightheadedness, brain fog, and sometimes even fainting. This can make simply standing in a line or taking a shower a major challenge. Digestive issues are also incredibly common. Many people with hEDs experience problems like acid reflux, bloating, constipation, and symptoms similar to irritable bowel syndrome, IBS. This is because the connective tissue in the walls of the digestive tract can also be affected, leading to issues with motility, the movement of food through your system. So, how is hEDs diagnosed? This is where it gets tricky. Unlike other types of EDS, there's currently no known genetic marker for hEDs. This means there isn't a simple blood test to confirm it. Instead, diagnosis is based on a strict clinical checklist, known as the 2017 hEDs diagnostic criteria. A doctor, usually a rheumatologist or a geneticist, will perform a physical exam to assess your joint hypermobility using something called the Batten score. This is a 9-point scale, where they test the mobility of your thumbs, pinkies, elbows, knees, and spine. But the Batten score is just one piece of the puzzle. The doctor will then look for other signs and symptoms. This includes things like that soft, stretchy skin, unexplained stretch marks, hernias, and a family history of the condition. The criteria are designed to be very specific, to ensure an accurate diagnosis and to differentiate hEDs from other hypermobility spectrum disorders. Getting this diagnosis can be a long and frustrating journey for many, often involving years of being misunderstood or misdiagnosed. Once a diagnosis is made, What's next? V. There is no cure for hEDs, so management focuses on treating the symptoms and improving quality of life. This is a highly individualized process because hEDs affects everyone differently. The cornerstone of management is usually physical therapy. But this isn't just any physical therapy, it needs to be led by a therapist who understands hypermobility. The goal is to increase flexibility at S, to build strength in the muscles around the joints to provide the stability that the ligaments are lacking. V's. Helps reduce dislocations and pain. Pain management is another huge component. This can involve a combination of medications, braces to support unstable joints, heat or cold therapy, and gentle activities like swimming or Tai Chi. It's about finding a sustainable way to manage pain without relying solely on medication. Managing the co-occurring conditions is also crucial. For POTS, this might involve increasing salt and fluid intake, wearing compression stockings, and specific exercise protocols. Through digestive issues, it could mean dietary changes or working with a gastroenterologist. And for fatigue, it's about learning to pace yourself. This concept of pacing is vital for anyone with a chronic illness. It means learning to listen to your body, understanding your energy limits, and not pushing yourself into a boom and bust cycle of overexertion, followed by a crash. Living with hEDs can also take a significant toll on mental health. Dealing with chronic pain, fatigue, and the unpredictability of the condition can lead to anxiety and depression. It's so important to have a strong support system, whether that's from family, friends, or a therapist. Finding a community of other people who understand what you're going through. Other zebras, as we call ourselves, can be incredibly validating and empowering. Why zebras? Well, there's a saying in medical school, when you hear hoofbeats, think of horses, not zebras. It means doctors should look for the most common diagnosis. But sometimes, it really is a zebra. People with rare and invisible conditions like hEDs are the medical zebras. So, to recap, Hypermobile Ehlers-Danlos Syndrome is a complex, inherited connective tissue disorder. It's characterized by widespread joint hypermobility, unstable joints, chronic pain and fatigue, and a whole host of other potential issues affecting the skin, autonomic nervous system, and digestive tract. Diagnosis is clinical, and management is a lifelong, multifaceted approach focused on physical therapy, pain management, and addressing co-occurring conditions. I know this is a lot of information, and if you're watching this because you suspect you or a loved one might have hEDs, it can feel overwhelming. But knowledge is power. Understanding the condition is the first step toward getting the right help and learning how to manage it effectively. Remember, if you are struggling with your physical or mental health, please reach out to a healthcare professional. You are not alone in this. Thank you so much for spending this time with me today. I hope this video has been helpful and informative. If it has, please give it a thumbs up and consider subscribing for more content on health and wellness. And if you have personal experience with hEDs or have any questions, please share them respectfully in the comments below. Let's support each other. Take care, and I'll see you in the next video.